my first ever time going live on Instagram. I've been wanting to start this Trainer Tip Tuesday thing for a while. But now here we go. It's a Tuesday, I'm bored. We're gonna do it. So I thought we would start with my creepy baby on the stairs and talk a little bit about knee pain, which is really common for mamas. It's common in pregnancy, often as the body gets loaded with extra weight. I mean, that's just gonna happen eventually in second trimester, third trimester. And also as the joints become a little bit lax, it's really common to feel some discomfort in the knees when you're doing exercises or movements where they would be loaded, like going up a set of stairs. In postpartum, those joints are often still not super stable, and we are also often carrying extra weight. Plus, then we load on top of that a kid, and we could be talking about a 10-pound baby, or we could be talking about like a 40-pound preschooler. So what we want to do is learn how to climb the stairs properly to manage knee pain. Now I just want to say, if you have knee pain in pregnancy or postpartum, there's a lot of factors that go into that. Often there's issues with your alignment and strength. It can be lots of things from the feet all the way up to the spine. So I don't want to simplify here and say that simply climbing the stairs in a different way is going to end your knee pain, but this can be a way to cope and make it more comfortable for you while also learning how to move your hips a little bit better generally. So let's get our creepy baby, okay? And I'm gonna show you the way that you would commonly climb the stairs. Also, this blue carpet, I find it's just meditative. It helps me focus on my stair climbing. So you do wanna have gripping surfaces on your stairs when possible so that you're not constantly in fear of slipping. So use a runner, because that's a good idea with little ones. Now, if you're climbing the stairs and you are leaning in like most of us do, this is what we do. We put the foot on, we kind of lean to the ball of the foot, and then we go up, 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 up like this. And we basically, our body finds a way to do the work with the littlest amount of movement possible. That's kind of the body's job, to find the most efficient path to things. So we have to train it to find, sometimes not always the most efficient path, but the path that your body was originally built to do, and that's through the hips, not through the knees. So as we get older and wiser and lazier, we learn to really load up the knees and kind of run up the stairs in the forefoot, so putting a lot of weight into the ball of the foot and the toe. And that just loads that knee. It's a very small movement, but it loads it repetitively. If you have stairs in your house, like I said, especially if you're carrying kids, that can be a lot of loading over the course of a day, running up and down as one does. And so what we want to do instead, it can feel a little bit silly in the beginning, but we want to load up the hips. So you've got your kid, okay? Hopefully you're holding them on your center of your body. You're not always going to be, but try when you can. And you're gonna step and you're gonna load into the heel. So you can see I've slightly sat my bum back. I'm not leaning forward, but I've slightly set my bum back so I can access the glutes. That depends also on how long your leg is. You might not need to put your leg back, but my thigh bone is long. So I have to sit my bum back a little bit and press into the heel. And then I actually stand fully on each step. So that might look like something you know as a step-up exercise, which is basically stair climbing turned into an exercise. If you have long legs, sometimes 2 stairs can be a better way to get that alignment with your body, but 1 stair works too, and you definitely don't want to take too big of a step and then have any symptoms in your pelvis or hips. So try to stay with 1 step if you can and just practice that first, and then move up to 2 steps when you can do that. So we want to go bum back and push through the heel, fully extending at the hips each time. And obviously I wouldn't always go that slowly. This is what it looks like when you do it like a normal person. It looks like this. So you can see my heel is coming down on every step. Hopefully you can see that. My heel is coming down on every step, and I'm basically bending and then straightening the leg on every step, and that should make a huge difference. It does feel a little funny at first, and it's not going to stop your knee pain if you have issues with alignment, but it will help you to reduce the amount that you're loading that knee if it's sore. Okay, so I will be doing another tip next Tuesday. If you have a question for me, I'm going to post something in my story so you can send me a question. It could be about baby related stuff, postpartum, pregnancy, meal prep for moms, organization, anything like that. Okay, thanks for watching, guys. How do I turn this off? And